It's a little bit odd in many ways. On one hand, they are being super cautious, referring to those under 50, not under 30 as the UK has done. But on the other hand, it's not a rule, is it?
No, it's not. Look, I think that's quite an interesting point. There's a couple of reasons, I think, for this advisory rather than having a set rule. One of them is the fact that there are people already booked in the 1B category, Chris. I've seen people asking the question online. They're booked in. They might have a vulnerability, for example. They might have a medical vulnerability, or they're a frontline healthcare worker, and they're ready to get the jab. Well, should they still get the option? You'd say yes. You spoke about the tiny risk right there. Otherwise, who knows when they actually get the jab, given the supply of Pfizer. So that's one reason. The other one was alluded to late on in that news conference, and that is this is advice for the situation we're in right now. That includes the very low number of COVID cases in the community, and of course, we don't have dire strains here. So we don't want to say this vaccine's no good for under 50s. That situation changes down the track. You don't want to send that message out that people under 50 just cannot have it. Here's what was just announced. Pfizer now the preferred vaccine for under 50s. We'll talk about the implication of that in a moment. AstraZeneca still safe for 50 plus, including for a second dose. So if you are under 50, you've had one dose, you're safe to get that second dose. The rollout to be revised. Now, there are a lot of impacts on this rollout. Let's run through them. 1B, that category I just spoke about, well, that's going to be delayed. We heard that from the Prime Minister. Also, the overall rollout is going to be delayed. Why is that? Well, AstraZeneca was carrying a huge load. Pfizer, which would be relied on next, we have a lot of those doses, 20 million we're promised, but they are going to be delivered throughout the year. The comments from Pfizer this year, well, they will be up till December, they still could be delivering this. So, getting that jab into arms by October, that previous timeline, that appears just about gone as of today. The other backup, Novavax, it's not yet approved, Chris. Yes, we have 50 million doses of it, but that could maybe be online in the third quarter this year. And we're getting it from, guess where? Europe. So perhaps, and this is another implication, we might down the track, and this is leaping ahead, yes, but retool CSL to make Novavax. That was, yes, a possibility, alluded to by the Prime Minister Scott Morrison. Not so much just for this year, but what about the future? What about future strains? If there's permanent advice around certain age groups for this vaccine, AstraZeneca, well, then aren't we better off making Novavax if, of course, that's seen as safer for more people? And just the final implication I'll get in there is Papua New Guinea. So much spoken about in that country and other countries to our north that are dealing with a COVID crisis, so many more deaths. Now, they have a very young population. Only 9% are over the age of 55. So what happens for them? Will they still want the AstraZeneca vaccine? Now, you might well say, and you'd be right to say, they're better off having it, given the death rates and the COVID rates right there. But vaccine hesitancy is already an issue in Papua New Guinea. They look to Australia for a lot of advice and influence. So that will be a concern from authorities as well. Even if they can get AstraZeneca from Europe or perhaps from Australia to Papua New Guinea, will they now have the same take-up? So already so many implications from this. Of course, the government's done it out of an abundance of caution. Part of this is about the risk, but also you'd have to say confidence, given so many other countries taking this action. It would have been difficult to not take any action at all. And of course, they're saying they took data from overseas, from the TGA, and from the situation in Australia right now. So, as you've said, never a dull moment, a significant day. I think there'll be more news to come out of this in the next few days as different permutations start to be realised.
Yeah, good.